On Monday, South Korea joined many countries around the world to allow the people to have the option of not wearing a mask when taking public transportation. Now, how has the response been and what measures remain in terms of COVID-19 related rules? For more, we're joined by Dr. David Kwak from Soon Chun Hyang University. Welcome back to the program.
Good morning. Thanks for having me.
Good morning. The country confirmed just over 12,000 new COVID-19 cases on the first day, which is Monday, without mandatory mask wearing on public transportation. Now, that figure would obviously not yet reflect the eased mask rule, but how do you expect the infection trend to move going forward?
Well, what I see just recently is that, as you mentioned, the lift of the mandates for the mask does not necessarily show up in its effects right away. But what I've seen in the past 2 months or so, with also gradual lifting of the masking, I've seen that people kept on their mask most of the time, despite walking on the streets, or whether that be, inside a hospital or inside restaurants. When people were just generally taking on their daily activities, they decided to keep their mask on. So I don't think the effects of lifting the mandates have shown to the society yet. But what I see just recently was that I saw a gradual increase in number of people who started to take off their masks, especially on the streets, in the places where they feel safer to do so. And with the lift of the mandates for, keeping the mask on in the public transportation, even though not suddenly, probably more in the sense of gradual, in fashion of gradual, I think people will be starting to take off their mask. In regards to the effects of it, however, also because of its gradualness, I think there will be a gradual increase in the number of daily confirmations also. But I don't think it'll affect in a way that it'll suddenly increase to the number that we did not foresee before. So I anticipate that we'll begin to see more of a fluctuation in a very gradual fashion of increase and decrease in the numbers of confirmation cases.
Certainly. I'll be honest, it took me one full day to not wear my mask.
Well, it's hard for us because it's become a habit for us.
Right, very. And looking back, we've had multiple rounds of COVID-19 infection waves. And the question is, are we done with spikes in infection numbers? I mean, if not, how many more are yet to come? What do you think?
Well, referring back to the sort of gradualness of these measures that are happening, I don't think there will be a sudden spike in the number to come in the future. People, because they have been exposed to the massive numbers before, and they have been quite thoroughly vaccinated, the amount of people who will start to lose their immunity against COVID-19 would sort of differ for different age groups, different situations, different backgrounds of medical entities. So I think, as I said before, now in the future, I think it'll be more likely that we'll start to see gradual fluctuations rather than sudden spikes and sudden drops in the numbers. So if you ask me a question to foresee how many more spikes we would see in the future, I don't think we'll see any spikes, but it's more likely that we'll see gradual uphill and downhills of the numbers.
Right, multiple ups and downs in the number of infections to come rather than spikes in the infection numbers. All right.
Probably.
All right. Thank you so much, Dr. Kwak, for your insights again this morning.
Thanks for having me.